One of the things that is usually causing blood pressure in younger people is what we call CGN, chronic glomerular nephritis. That is one of the commonest cause of hypertension in the young. Then another one is what we call hyperrenism or something, hyperaldosteronism. Now, why it is important when you see the blood pressure in the young person is, number one, is that if you look at that blood pressure in a younger person, it is likely to have a cause. And the worst aspect of it is that most of the cause is coming from the kidney. So if you follow it religiously, you can be able to quench the hypertension and also quench the possibility of that person developing chronic kidney disease in the future. That is number one. Number two is that once you have a blood pressure in the younger person, it is not usually business as usual. If it occurs in a male, you are concerned about so many things. Number one is that it's not every drugs that they can take. There are some drugs that when you take as a man, you can have erectile dysfunction. You will give that person drug to treat his BP. Tomorrow he will come and tell you that his penis is no longer standing up again, which is coming from the effect of the drug you gave to that person. Before you treat that blood pressure, we must always consider what is the age of this person. And there is no way a man somebody will check his blood pressure and the blood pressure is high. They will tell him you have blood pressure. He will say, okay, let him go and take his father's BP medicine and take. That your father BP medicine might be okay for your father, but will not be okay for the young man. Another thing we consider is, if this person is a woman, does she has reproductive tendency? Does she still want to take in? If she still want to reproduce, again, the type of drugs you will give to her is not the same as the one that you will give to somebody who has completed her family. If that person has completed her family and she might be 30, but she has completed her family, you look at her, maybe she have done family planning or she has no intention of giving birth. She had already 4 kids, yet she is 30. There are some drugs you can give to her even though she is 30 years, but you will not give it to the other person who is 35 years, who still want to have children. Raising blood pressure in the young, it goes across a whole lot of things. Number one is that, what is the age of this person? What is the gender? Is he a male? Is he a female? If it's a female, we still have to narrow down the question. Does this still want to have children or not? What is the age? Is there any effect of estrogen in this thing happening to this young lady? And again, when you want to investigate what actually is causing this blood pressure in the young woman, we must take into consideration, has she been having chronic miscarriage and whatnot? Her obstetric history might tell us this is actually what is causing this blood pressure. By the time you come to the conclusion that this is what is causing the blood pressure, we will be able to address it appropriately. But if we see BP in people that are already 70, 80, managing those one is not an issue, because whether he's a male or female, if he's a woman, even if she has not completed her family has completed itself, so no need. I don't know if you understand. Now, if it's a male, we might now start thinking, let us give a drug that might also prevent prostate enlargement while we are still treating the blood pressure. So we take all of them into consideration. There are some drugs, like Dr. was saying, we can give it to the male, we will not give it to the female. It doesn't mean it cannot cure blood pressure in the female, but it has all that advantage when you give it to the male child, to the male man. It's okay. Now, if we now come and say somebody's blood pressure is 80/60, all these drugs we talk about high blood pressure now, whether it is essential or primary or secondary, there most times people has a natural blood pressure that is lower than normal. Now, in as long as we say the blood pressure is above 140, there might be some people who might have normally their blood pressure is 90/60. It is not a time you ask them, do you have hypertension? You say no, it's the low one that I used to have. There's nothing like low blood pressure, because that every low blood pressure has something that is causing them. All we need to do is to address the underlying factor, and the blood pressure will come up. But if the person is not feeling any symptom, it's not a time that you go to the chemist and you measure your BP is 90/60. Somebody will say, go and take alligator pepper, take Sprite and take this thing. Those things are not necessary. Unless there is electrolyte loss, unless there is stooling and vomiting, and we know that this is what caused it. Maize, Sprite and salt might be able to help you. It doesn't require intervention. It doesn't require treatment.